how do the PRP and the cell-based therapies work? So PRP, as you know, that's platelet-rich plasma. The way that it works is it releases all these growth factors. There's hundreds and hundreds of them. And these growth factors have different jobs. Some of the growth factors decrease inflammation, which is probably what gives you the pain relief, the immediate pain relief from the PRP. Most importantly, there's a lot of this different group of growth factors that stimulate tissue repair. They stimulate proliferation of the tissue so that you can heal tendon tears or ligament injuries or cartilage injuries. They stimulate the formation of blood flow so that more nutrients and more cells can get to the area. They also enhance nerve repair. There has been studies that shown that patients with carpal tunnel syndrome or a sciatica in the back, if you inject PRP, it actually keeps the nerve healthier. So there's a lot of different factors. It's a little complicated, but those are the most common factors by how they work. The stem cells work fairly similar. It's a little bit more complicated pathophysiology, but they work in a similar manner. So what these cells do is they actually release molecules. They act like basically like a mobile drugstore. They release all these molecules that are involved in healing tissue. And all these molecules also call upon other cells that are needed for the body to repair the tissue to come into the area. That's what they call the paracrine effect. And depending on the signals that they get from the local injury, they basically call in whatever cavalry is needed in there to help repair the tissue. That's what's amazing about this. Our cells, our body is very intelligent in trying to heal itself. And what we're doing by doing these regenerative therapies is we're just giving your body a little push to help jumpstart this healing process, but we're letting your body do its own natural abilities to heal and support that. These stem cells also, they control inflammation. They have what we call an immunomodulatory function. They also fight infection. They have a natural antimicrobial properties to it. So it's rare that we have to give you antibiotics if we perform these procedures. Unless we're going into the disc, sometimes we do give you antibiotics to prevent infections. But most of these therapies do not need antibiotics for treatment.